Good morning, everyone. I see we have some people still coming in. Looks like we'll start. Maybe we'll give it one more minute and then we'll get started. And while we're waiting, if you would like, please feel free to add your name, your role, and your organization in the chat, just so we can all see who's on the call today. Good morning, Connie. We have some Kansas City Health Department, community health workers, that's great. Community Health Department, okay. Community Services League, great. Guidance counselor, great. Community outreach coordinator, awesome. So a lot of community people. Okay, I think we'll go ahead and get started. We do have some people joining still, but we'll just go ahead. So good morning, everyone. Thanks for joining us today. My name is Megan Rooney. I'm from Health Literacy Media, and we are working with Kansas City Health Department to develop a series of workshops as well as health materials for you and the community in Kansas City. And we're covering lots of different topics such as clear communication, talking about COVID with patients, and much more. I am joined by Lisa Carey, who is our Senior Health Literacy Writer and Training Manager. And we are a group based out of St. Louis, but we do work with organizations throughout the state, throughout the Kansas City region as well. And we're a health communications group who specializes in helping people communicate clearly about health. We do that in lots of different ways. We love to hear your thoughts and questions throughout the workshop. So please definitely use the chat as much as you'd like. You could also unmute yourself, ask questions. We would like this to be as interactive as possible. So before we start, and Jeremy, you could go ahead and move the slides forward. Have someone helping. We have Jeremy on the back end helping with the slides. Okay, so I'm a couple more past that. Yeah, one more. So before we start, we want to tell you a few things about this workshop. So during the workshop, your audio is muted to lower background noise. But like I said, please feel free to turn your camera on, unmute yourself, use the chat. We have a couple of Zoom polls that we'll be doing. After the workshop, we'll also put a survey in the chat, and we ask if you fill that out as soon as you can so that we can learn how the training went and get your ideas about future trainings. So we'll also send a summary sheet of the training in the next couple of days. So don't feel like you have to, write every single thing down. We'll also share some resources on that sheet for you. So here's what we're going to cover today. How has COVID impacted our society? How has it specifically impacted mental health? How can we support mental health? And then some helpful resources. So the first thing we're going to do is pull up a little poll. I think Jeremy is probably helping us on the back end get that going. But we're going to ask you if you or those you work with have had COVID. So what's your experience with COVID during this pandemic, just to kind of get a read of the room? At this point, it does feel like most of us have had it or been working closely with people who have had it. It's just these strains have been so contagious that it's just hard to avoid. So I do see so far we've got majority yes, which doesn't surprise me. Amy says I've had COVID twice. Yeah, I mean, many people have had it 2-3 times now. It was terrible. So I know it's hit a lot of people hard. It's hit other people, in a pretty mild case, but it looks like about 92% have either had it or work with people who have, and 8% say no. So there's still some people holding out. And hopefully it stays that way for you. Okay, thanks. So the next slide, we're going to do another quick poll. We're interested in how COVID has, impacted us. What are the experiences and changes that you discuss when you're talking with people or thinking about the last 2.5 years? And we have a different poll that we'll pull up so that you can answer that question. And then in those discussions, how often does mental health come up? So we'll give you a minute to think through that. So I'm seeing about 40% of people who have answered, no, about 50% so far said it comes up often. Some people are saying not often. A smaller percentage says it always comes up. Okay, so it's still coming in, but it looks like about half are saying it often comes up. And then about the same amount are saying not often, sometimes, or always. So it's coming up pretty often in conversations. Jeremy, are you able to see the answers to the first question? So what experiences and changes do you discuss? I can't quite see those answers. So I'm wondering if okay. I can't quite see those. I'm sorry about that, but I can definitely see that it looks like the majority of people are saying that that mental health does come up. So it's not surprising, and it's being recognized more and more as a negative outcome of the pandemic. But on the hopeful side, we also know that people are resilient. And as we'll see, we'll share some examples of how people have come up with new ways to cope and help those around them. So when we talk about COVID's impact, the ecological model is helpful. Have many of you heard of the ecological model? And you can raise your hand or even raise your virtual hand. I know some of the public health people have used that for sure. So I see some yeses. I see a no. Okay. So the ecological model is a great way of, it's a framework for how we can think of certain concepts. So we can think of it in the context of COVID as how it's impacted us at every level of our lives: individual, interpersonal, community, organizational, and societal, and at the policy level. And then, of course, these impacts flow. So they trickle down, they move up. So when one level is impacted, it impacts the other levels. So these are all interconnected, but it's a nice way for us to frame it. So we weren't able, on the last slide, I was hoping to hear a little bit from you about ways that it's impacted you. So feel free to type that in the chat, but we also came up with some ideas. And Jeremy, you can click. So we've also come up with some ideas here. We know that it has affected us globally as far as supply chains and how that has trickled down to so many parts of our lives. So many of us are still dealing with anxiety around getting sick. The actual sickness, which a few people I see in the chat have said they've had it. It's terrible. Looks like Connie is saying, I noticed people have been more stressed, and me too. Cultural polarization has been wildly impactful, and I would agree with that. I've had the same personal issue with that, is people's opinions around the pandemic and how to behave and how to protect each other. I mean, in the midst of this kind of political scene has been really devastating to a lot of families. I agree. So daily routines have been disrupted. For a long time, community groups were not meeting because things were shut down. We do see that slowly starting up again, so that's great. More people are seeking mental health help. And actually, there is some data to show that it's increased 5 times from 2019 to 2021. Self-reported anxiety and depression is up globally 25%. So we see what you're saying is true in statistically as well. Zach is saying most people are in survival mode, and it's been like that for years now. Actually, in doing some research for this presentation, one of the researchers I was reading up on actually used that same phrase. A lot of people are still acting in survival mode. Totally agree with that. Financial pressure, people have lost jobs, forced to work less. People have lost businesses. People have had more medical bills. And then, of course, the big and bold one is we've all been isolated. We've had to cancel important gatherings, these things that we rely on for our social interaction and our happiness. That's been just completely, shut out for the last couple of years. And that's had a devastating effect on our mental health. And then lastly, of course, grief. So many of us have, and Connie says that right there. People have lost friends and family to COVID. So a lot of grief around death, grief around loss of, normal life, loss of years of education. And there's just a lot of grief going on in our community. So absolutely. We have one example to share. And so this is an example in St. Louis. Jeremy, you can go ahead and, there you go. So in early 2020, non-essential businesses shut down, which included places of worship. So in November of 2020, St. Louis County restricted gatherings to a lower percentage. So this led to a decrease in members in specialty services. So going to visit hospitals, visiting nursing homes, people were physically and emotionally distanced, so leading again to feelings of isolation, loneliness. Restrictive behaviors like social distancing had an impact on people's attitudes towards socialization. And this particular pastor of this church reports that there was no hugging, no handshaking. People were reporting just a less friendly spirit. So, what does that do to that community that really relies on those connections? People faster to leave after service and just less, a breakdown of the familiar community. And so this pastor said, we've actually had people, Jeremy, you can click the quote right there. So this pastor said, we've actually had people grieving the loss so much that we've had fairly significant mental health issues because of this. And so that's just one example to show you, how something at the community kind of policy level affects the communities, affects the organizations, affects the individuals. So now we'll move on to the section on mental health specifically. So we're talking about kind of globally how it impacts us, and now we'll drill down a little bit to how it impacts us on the mental health space. So we're going to ask you to share a little bit in the chat here your thoughts on how COVID has affected your mental health and the mental health of those around you and people that you serve and work with. So feel free to add those in the chat. We'll give you a minute to think through specifically, like, what are the mental health effects? So I see anxiety and depression, which are at the top of the list. If you look up, the most common mental health issues of the last few years: stress, denial, anger, agitation, but also acceptance. So important. Thank you, Gerald, for mentioning, the positive. We have people accepting just the state that we are in. Tiffany says, I still have symptoms a year later. It takes a toll on me. So I'm assuming you're referring to like COVID symptoms. So, the long COVID symptoms that people are going through, they're still feeling physical symptoms, still feeling the emotional symptoms of long COVID, which is actually quite common. I believe it's up to 1 in 5 people who has COVID has long COVID. So thanks for mentioning that. It's devastating. Stress, anxiety, fear, absolutely. Fear of it getting worse, fear of the sickness, just the anxiety creates fear, distancing behaviors. So gosh, yeah. Oof. Family stress, paranoia, fear of contracting COVID. Also, Zach mentions friends with children below the age of vaccination. Absolutely. I mean, that's a group. From personal experience, I'm in that group, but that's a group that wasn't, talked about a whole lot. But what about families and caregivers that have these little kids that couldn't be vaccinated until just recently, and all of the stress of that just weighs on you all day, making those decisions constantly about what's safe, what isn't, the worry, lack of trust. Absolutely. Are people around me doing the right thing? Absolutely. And I don't know about you all, but I feel that a lot now. People aren't wearing masks. Like I go in places, I still personally mask just because that's what I'm comfortable with. But, I'm worried. Are they not masking because, they're doing the right things, they're being safe, or are they just are they over it? And does that put me and my family at risk? So we're doing those risk assessments constantly. Not being able to see, gosh, you guys are adding such great ideas here. Not being able to see people before they die. Absolutely. No closure around death and the loss of our friends and family. Sometimes you just have to roll with it. And that says, look at what good came out of it. Absolutely. So again, there's that acceptance, that hopefulness, that resilience, which we'll get into a little bit. Bedtimes got out of control. Yeah. So it's interrupted sleep and patterns, daily patterns. Absolutely. So we could go on and on, right? Unfortunately. So thank you guys for sharing all those thoughts. So before we move on, I want to talk a little bit about trauma. And a lot of us are kind of pointing and hinting at trauma. So when we're thinking about ways, and Jeremy, you can advance the slide. When thinking about ways to support mental health, we want to think about the trauma-informed framework, which I'm sure a lot of you know a lot about, and examine the role that trauma plays in this. So, and we can define trauma as a person's emotional response to a distressing experience. The warning signs: irritability, trouble sleeping, drinking or using substances more than usual, fatigue, loss of joy, viewing the world as unsafe is a symptom and a cause of trauma. And so this has just been the most traumatic collective event of our lifetime. And I'm going to hand this over to Lisa for a couple of slides to talk a little bit more about the impacts of COVID on those different levels in the ecological model.
Okay, thank you. So yeah, let's keep talking about this. Here are a few facts. In a recent survey, the American Psychological Association found that nearly 2/3 of respondents said that their lives had been permanently changed by the pandemic. The World Health Organization says the pandemic has sparked a 25% increase in anxiety and depression worldwide. Another survey found a significant increase in the demand for mental health treatment in 2021. And, that's not surprising considering how it's affected people. Another survey showed the pandemic is an independent source of traumatic stress. And for a subset of people, that stress can predict the development of post-traumatic stress disorder or PTSD. So, if you're a person who's already dealt with loss and trauma in the past, there's actually an increased risk for PTSD, that the whole pandemic was harder for you. And then the greatest psychological burden has been felt by those in the helping professions. And a lot of you here today represent those helping professions. So, it's really important to talk about this. It's not to be glum, but, we will cover after this section, we're going to cover resources and ways to kind of help buffer this traumatic response. Okay, so next slide, Jeremy. Okay, so the model in the upper right corner of this slide shows the different levels of impact that COVID has on people. And we've covered this a little bit already, but at the individual or personal level, there's isolation, depression, anxiety, increased substance use, misuse, and then the symptoms of long COVID. Okay, next slide. Okay, now we can look at how COVID affects people, at the interpersonal level and community level. And one example would be how young people have been disconnected from their support structures. Kids and teens have lost many services and resources that schools and their extracurricular activities used to offer. So here are some facts that we'd like to tell you about that. 1 in 3 youth dealt with poor mental health during COVID, including sadness, hopelessness, or even abuse from someone in their household. Suicide attempts have risen among people under 18, according to the CDC. Emergency department visits due to mental health crises increased by 24% in children ages 5 through 11 and 31% in ages 12 through 17 in 2020 compared to 2019. That's a huge increase. And next, before the pandemic, there were limited child and adolescent clinicians, about 4 in 100. And since then, the numbers have fallen from there. Okay, let's go to the next slide. At the organizational level, one example is the stress on mental health services. More people are seeking help. And this is a good thing, but the system that we have in place is not always able to handle this increase. Some patients have lost their services and may not have gotten them back. And then in all of this, some providers really had no capacity for new patients. There's also been tremendous stress on providers, including health provider burnout. And when things were shut down, some providers actually stopped practicing. One study in the southeastern US said that over 60% of providers in one area stopped providing, and 50% went exclusively to telehealth services. And then the quote, Jeremy, one researcher stated, "We need to recognize that secondary trauma occurs within work settings, and organizations have a responsibility to create a culture where the staff and professionals can admit to that and seek help." Okay. So now to the action steps. Like, we've listed all of the problems. We're all aware Now let's talk about, how can we support mental health in ourselves and in communities? Okay, so let's get back to this model. We'll now discuss strategies to support mental health at the individual, interpersonal, and community levels. So there are many ways, that we can cope with the impacts of COVID. And here are just some daily strategies that you can do or that you can support your clients doing. First, ask for help if you need it. Sometimes our coping strategies aren't enough, and in those cases, we can remind ourselves and others that we can break through the stigma of needing to seek professional help. First steps, talk with your doctor, check with your insurance plan to make sure that it covers that the services that you need. Next, kind of take it slow. We're still getting back to the new normal. We can start with only what we're comfortable with. And then, start small, like if you've been getting your groceries online or, through delivery, maybe go ahead and take a trip to the grocery store. Try and start getting back into those routines that you had before the pandemic started. Next, talk about your worries with people you trust. Chances are they know how you feel, they can empathize. Expressing your emotions can help you see problems in a new way. And if you feel like others understand, then, that makes you feel better. Next, take breaks from the COVID-19 headlines. It's so pervasive in the news that it can really be good for you to take a step back and just limit the amount of news you're taking in about COVID, because it can really wear on you over time. Next, take care of your body. And of course, we all know how important exercise is, giving you endorphins, helping you break cycles of negative thoughts. Eat healthy, try to eat less fast food, salt, and sugar. And then hopefully some of you meditate. Meditation is a way to help focus on the moment and focusing on that one thing and relaxing yourself. If you do that consistently day after day, it can really benefit your mind and your body. Connect with your community for support. Join some community events in a way that you feel safe, and spend time around others. We're definitely, social creatures, and we need that connection. Even if you don't get close to someone, just seeing other people can help. Writing is another great way to show, it shows that it can help us feel less sad, and just getting those feelings down in a note is good for us, and write someone else a note. Just knowing that you're making that connection can help. Being creative in ways like painting, drawing, taking nature walks, playing music, cooking. Next, if it's the right time for you, maybe consider getting a pet. Studies show that pet owners are less likely to feel alone. So this might be your chance, especially if you're now working from home. And then finally, try random acts of kindness. Helping others can send those feel-good chemicals racing through your body and make you feel happier and more connected. So along with the Kansas City Health Department, we actually have a handout with these tips, so it's all in one place for you. Okay, so let's see what you've all been up to. This is a little activity that we call Pandemic Bingo, that we're all going to play. We're going to split into 2 different breakout groups, and it's just just for a few minutes, and together in your breakout room, you'll list all the activities that you've done during the pandemic to help you cope. And then when we regroup, we will see, we have a little chart with different activities, and you'll each have Megan and I will be in the 2 breakout rooms to check off and see if each group made bingo. Okay, so let's move to the breakout rooms.
Okay, let's see. So I think Lisa and I are going to share. Looks like we've got some more in the chat. We baked bread. So we did get bingo. Lisa, did you all get bingo?
Sorry, I had to unmute myself. Yes, we did. We got bingo across the top.
Okay. We got bingo across the middle row. So everybody gardened, cooked, groceries delivered, shopping. We also had people who went hiking, biking, home renovations. What do we do? People watched a lot of TV. Some people watched less TV. Someone adopted a pet, and a lot of people said they FaceTime families. We also had people say that someone read the Bible. Some connected with church as a new activity, driveway visits, which I feel like were really common at the very early stages. Education, some people started a program, so a master's program. And then, like I said, some people just connected with family more and did less TV watching. Lisa, did you all have any other activities?
Yes, we did. So yeah, we did the things across the top and several of the others, but some of the things that weren't on the sheet were somebody took a lot of naps. Another person became a homeschool teacher. Someone bought an RV and started camping. Another person, a couple of people, in fact, changed careers. Somebody else volunteered, and one person drank spirits. So,
Drink spirits?
yes. So it was fun.
Yeah. Okay. Awesome. Well, thanks you guys for doing that. Humans are resilient. Humans find ways to cope and stay hopeful, and it's amazing to see. So thanks for sharing that. Okay, we're going to move on to a couple more ways to cope. We're going to move to ways to help others. So that kind of next level up, we talked about the individual level, and now we'll go up to the interpersonal level. So raise your hand or your digital hand if you reached out to anyone during COVID just to see how they were doing. And you're all helpers, you're all in the helping profession. So I am sure that all of you did, and in different ways. So, it's something definitely that comes naturally to us, especially in the professions that we're in. But really, it can be as simple as that. Isolation can do funny things to our minds. And sometimes something as simple as a text message or a quick call to let someone know you're thinking about them is all they need that day, just to kind of lift them up a little bit. So, and some people need you to be the first one to reach out if you're so inclined. And this could just be someone to listen, help finding coping strategies, or even encouragement to get help for people that are at that point where they really need professional help. And so next, we're going to move to a more practical strategy, mental health first aid. And so has anyone taken mental health first aid or at least know about it?
Yeah, just last week I did mine.
Oh, nice. Great. So you actually took the course. Awesome. So a lot of people have, okay, so this is going to be old news to you all. So Brian knows parts of it. So we'll just kind of review it briefly today. But for physical injuries, we have systems in place like first aid, first responders, and the mnemonic CAB. So chest compressions, airway, breathing. For mental health, there's also a mental health first aid program that uses the mnemonic ALGAE. So I guess kind of a memorable acronym, but It teaches us, so it's a program that anyone can attend. It's for the public, how to recognize mental health problems, how to offer help, and then guide people towards appropriate treatment. And like I said, it's much more involved, and these are just the highlights. We'll offer some resources at the end and also in our handout that will give you the websites where you can learn more. So first, A is for assess. So you want to always focus on the highest risk. You're going to assess for suicide or harm. If you assess something, someone might hurt themselves or hurt someone else, of course, you will go straight to professional help. You go to 911, you'll go to whatever professional help is available. Next, the next most important thing to do is just to listen. So many people who are in distress often just want an empathic listener before you offer resources or you offer help. So listening non-judgmentally, so that's an open attitude, nonverbal cues that you're listening, so like head nodding, eye contact, staying physically focused on the person and really listening to what they're saying so that you understand what they're saying, but also what are the emotions and what's kind of the motivation and the drivers under what they're saying. So is it fear? Is it shame? How are they really feeling? This allows them to share in a very open, safe space so that then you can relieve some tension and move to the next step. So the next step would be to give reassurance and information. So now once that a person feels that they're heard, you can move to encouragement information. So this could just be empathizing. This could be voicing some hope. This could be offering practical help with other tasks that might feel overwhelming to someone if they're in that acute state of distress. And this is also when you can normalize what they're going through. So a panic attack, self-harm, thoughts of hurting themselves or depression, anxiety, mental health problems are common. They're very common. There's all kinds of help out there. And so the last two are encouraging help. So professional help and then also self-help. And so this could be things that they're open to. So you don't want to force something on someone, of course, but if they seem open to it, offering counseling, help finding a counselor, a support group, a spiritual leader, even connecting with their primary care provider. And then also the self-help strategies that we discussed a few slides ago. Excuse me. While you are, I'm sorry, I need to drink some water. Lisa, could you take over for 1 second?
Sure. So talking about a few tips while offering mental health first aid. I'm sure you're all great at offering affirmations, and these are just some phrases that you can offer to people that convey empathy, respect, concern, and support, such as, I appreciate you being willing to talk about this with me today. You clearly are a very resourceful person. That's a great question. I can see how much you love your child. I can see you've given this a lot of thought, and I can tell you value your independence. Next slide. So, the next thing you can do is to offer reflections. When you listen carefully to the person, you do active listening and not asking questions, but reflections is sort of once they, get to a stopping point, making a statement that is kind of your reasonable guess at what they're trying to convey, the meaning of what they've said. So you can do things like, so you feel, and then kind of summarize what they've said or reflect on what they've said. It sounds like you're saying, or sounds like you're wondering if, I hear you saying, and this really helps them know that you've heard what they're saying. It validates them. And then next, you can try and go do a deeper reflection of, how they're thinking or feeling on a deeper level, and saying things that are relevant to what they were talking about. Kind of like, here's, I hear that you don't trust people right now, or it sounds like you're very afraid. These types of statements really let them know that not only have you heard them, but that you empathize or sympathize, and hopefully it gets them sort of thinking about their feelings on a deeper level as well.
Thank you, Lisa. I think I'm okay now. I think
Okay.
I can take the rest. Thanks. And then of course, the important note before we move off of mental health first aid is assessing for suicide and harm. It's always something we want to ask directly about. You do not need to avoid these words. Sometimes people need to hear those very clear, specific words and nothing vague. You want to be confident, direct, and non-judgmental. Are you having thoughts of suicide? Are you thinking about killing yourself? So it can be, distressing to think about that and say that, but it's important that that's said explicitly. And then warning signs of suicide, threatening to hurt or kill themselves or others, talking, posting about it, feeling hopeless, feeling trapped, withdrawing from others. And as one expert puts it, people want connection, they're craving it, so much so that people who are the loneliest and are hurting the most will put suicide on hold at just the hope of getting connection. So important note that we wanted to point out in the discussion of mental health first aid. And like I said, there's a lot more training on this. This is just kind of touching on the highlights, but something to look more into for sure. And then the last little section we're going to cover is about community resilience. And so the Milken Institute, which you might have heard of, has developed a guide outlining concepts and tools for communicating and partner building, which is at the center of helping communities build resilience. And we will put a link to this document in the sheet that we send you. It's a really great guide. And so the framework uses called the BCR Framework. We will not get into the details of this right now, but it facilitates collaboration across organizations and systems, even those that might not have a health-related mission, but that influence health outcomes and community build resilience. So that includes criminal justice, housing, education, faith-based communities. At the heart of this framework is the pair of ACEs models. Has anyone heard of this? Some people have. Okay, Allie has heard of it. So this is a really, really wonderful model. Great. So a lot of you have heard of this. But it pairs together these two areas. So adverse childhood experiences and how they interact with adverse community environments. And so basically, if you have kind of this soil that is not healthy, so it's steeped in systemic inequalities and dysfunction, it prevents a thriving community. So, but these are ways that we can invest in things like economic development, affordable housing, education, and then that will kind of grow upwards as children and families are growing to improve these other areas of their experience. So it's a really nice visual, kind of a nice visual framework. The guide also shares practical ideas for building community resilience at the individual, family, and community levels. And Jeremy, you can click for that table. And as you can see here, these are specific ways to identify and connect with collaborators and community partners. So again, I'll refer you to the guide for this. And I think, Jeremy, we'll just move right to our activity. So we're going to spend a couple minutes together thinking through these questions. And I think we might have enough time for our breakout rooms. And so we're going to do just a very quick breakout room where we kind of just talk through these questions and think about ways of building a community, if you were kind of building a community from the ground up, how would you, how would you frame and how would you build the mental health capacity? And so, Jeremy, we can go ahead and do that and talk about that just for a couple quick minutes. Oh, thanks, everybody. I know this is the last couple minutes we have, but I really appreciate the ideas that you all shared. I'll just share quickly. In our group, we talked about anxiety and depression in specific populations, multilingual healthcare providers, how to challenge stigma, sharing resources across organizations and allowing improving access, so allowing providers to kind of share their services in different facilities. And then also addressing mental health at the professional level. And
So,
Lisa,
yeah,
do you have anything else to
in
add?
our group, we just, people talked about that they are seeing mental health issues much more so in younger people, middle school, high schooler, and even younger. They're being more vocal about their mental health issues and there's a need for more mental health training within schools.
In schools too. Okay, yeah, absolutely. Well, thank you all for thinking about that kind of on the fly. I think, definitely important work, and it would be great to continue that conversation as well. The last couple slides, I just wanted to share that we do have, and you can skip that one, Jeremy, but we do have some resources. You can definitely reach out and get these from the health department. And then also we have a list of health resources and websites on the next slide that we will include in our handout. And then lastly, we will put the survey link in the chat here. Jeremy, if you could throw that in there for everybody. If you have a minute, we'd love to hear your thoughts on the training, and also offer ideas for what you'd like to see in the future, including if you'd want more on this topic. We ran out of time at the end to talk more about building community resilience, but if that's a topic you'd be more interested in, we'd love to hear that. So please fill out that survey now or whenever you have time in the next couple of days. We really appreciate it. And thanks everybody for being so interactive and joining us today. We appreciate all of your ideas and on this really, really important topic. So thanks everyone for joining, and we hope to see you next month at the next workshop.
Bye.
Thank
Bye.
you.
Thank you.